Hi, my name is Altaf Vaya. I'm a pharmacist in Leicester and I have a special interest in looking at how staff members work. Today's talk I wanted to do was on mental health awareness and the topic was preventing and managing burnout. As the slide says, small steps today for a healthier tomorrow. So we begin this presentation by looking at why this matters for us. The statistics speak for themselves. 1 in 4 NHS pharmacy staff experience burnout each year. 73% of pharmacists report high or very high work-related stress, and we're 3 times more likely to make errors when clinically checking when burnout affects focus. We know that pharmacy is a high-pressured environment. People from outside community pharmacy might not believe that. Sometimes our patients think we're just putting labels on bags, but we need to recognize and address that burnout is not a weakness. It can happen, and it's essential for patient safety and team well-being that we address this. So there's some common signs of burnout. It's similar in most workplaces. You can get emotional exhaustion, feeling drained, overwhelmed, or unable to cope with the daily demands. We also have detachment, where you lose interest in work or feel disconnected from patients and colleagues. You have the feeling of being stuck, doubting your abilities, feeling ineffective despite your best efforts. And then you get the physical symptoms, where you feel tired, you get headaches, you're not sleeping, and you have a difficulty concentrating. Burnout is real, and recognizing the signs are the first and most important steps. Now, we know that many of our team members will see, or many of you who are watching this will feel that some of these emotions, the detachment, it happens to all of us. It doesn't mean that that's burnout. But what it does mean when we look at community pharmacy is that there is underlying issues sometimes that staff members have, our colleagues have, that we don't always address. And when colleagues come up to us and they need support, sometimes we're not looking at the signs or recognizing the signs that might be related to burnout. So it's quite important to look at this, touch base with our staff members, and just make sure that we're keeping an eye on how they're doing and if they need support, is it a sign of burnout? Because pharmacy is difficult. We have a lot of pressure from our patients. We have a lot of pressure from delivering services. And when you're working in a team, sometimes you feel like you are draining yourself to make sure that the pharmacy or the team is still coping. Pharmacy specific stressors, which we need to look at, is the relentless prescription volume. We've seen over the years that many pharmacies, the number of prescriptions has increased. We're seeing that with our wholesalers, we're finding we're getting a lot of owings and not being able to obtain stock, which is causing a lot of issues. We're getting lots of deliveries of or higher volume of stock from our suppliers, but also we're having to deliver a lot more to patients because we're in a day and age where if Amazon delivers, even though they have Amazon Prime and you pay for it, they expect pharmacies to do it for free most of the time, but in a service where you deliver to them when they want. Sometimes it's a demand on us that their expectations sometimes are higher than what we can actually deliver. And there's no pun in that. And the clinical services that many pharmacies are now trying to do, all trying to compete to bring in new services to keep our pharmacies afloat, because we do have specific issues in community pharmacy related to funding, or rather, I would say underfunding. We also have an issue where we have seen recently in community pharmacies and through the surveys through CPE, the abuse from patients, frustration, complaints, just having to wait for items can be a difficult process in itself. Staff and members of our teams are frontline in taking that abuse, and it's not nice. Nobody wants to go through that verbal abuse on a daily basis. And sometimes it's very hard to deal with these patients because they start complaining, they make a scene, and we're stuck with trying to not lose business from them, but trying to keep our patients with them without creating more of an argument. We're also seeing that as we're doing more blisters in community pharmacy, MDSs, when we're trying to do more prescriptions, our error rate is increasing, and we all fear that dispensing errors can cause a problem. I know nowadays there's PMR systems such as Titan and others that help to reduce errors using scanning processes. But again, that works to a certain degree. But all of us fear that even with the most robust systems, when you're under pressure, we all make mistakes. Everyone is capable of making mistakes. We're human beings, and even sometimes machines make mistakes that we're seeing in AI. So you have to rely on the way that you're working, but you need to take your time. And when you're under pressure, trying to do many tasks at once, that doesn't always work. We don't always give ourselves enough time to make sure that we're doing the best that we can. And that's not because we don't want to. That's because this job has a lot of demand on us. Again, as I mentioned earlier, we have stock shortages, which is a big problem at the moment. We have, day-to-day issues in pharmacies. Things go wrong, like any other profession, a business or any other business. There are aspects of that daily business where we do have issues. And I've just listed a few. It might be something like the fridge fails. You're chasing a wholesaler because items haven't come. There's missings. The PMR system's not working. Something's happened. The internet's gone. The smart card's not working. There's so many different errors or system faults that can happen in a day, and this can really bring stress on that pharmacy team. And I'd just like to add to that we also have teams. We rely on individual team members to be responsible. So whether that's pharmacist or the technician or the dispenser or the counter staff or the delivery driver. But again, we're human beings. Sometimes there's a shortage of staff. It increases the volume of work that we all have to do. And this can again cause pharmacy-specific stresses because people have roles to do. And if those individuals who are trained or skilled in specific roles are not available on the day or during the week, it can cause frustration, and it can again cause pressure on the pharmacy teams and individual team members. So what's actually driving it? And I think we're talking about burnout here. So sustained workload with no recovery time. We know and we hear when pharmacy teams are having prescriptions throughout the day. Some pharmacies are very busy with having no kind of time in between where prescriptions and patients don't stop for 10 hours in a day, for example. It's not like you can just close your door. And I'm not going to discredit any other NHS workers, but they sometimes work or other allied professions. They work by appointment system. In the pharmacy, if somebody needs medication or over-the-counter medication even, or they want general advice, our doors are open. It's very different to other professions where you have to book an appointment, and if you don't get an appointment, you don't get to see that working professional. In our case, the pharmacists and the pharmacy teams have to be available throughout the day even if it's not convenient for you, you still have to make time for that patient. There's lack of control over your day. Again, when you go into the pharmacy, you can't set, schedules, or most of us can't set schedules. Some pharmacies might have got this right and have workflows, which is great. Sometimes our staff and our colleagues and the pharmacists feel like they're doing more than they're recognized for. So when you have burnout, sometimes it's not just a burnout in a physical sense, but there's a mental stress here where the person feels like they're not being recognized, they're not being given enough credit for what they do, and it starts bringing self-doubt, and again, does not make them feel like they are doing their job correctly. They start doubting themselves, and in the end, they feel like their efforts are not looked at. Now, we all see that happening in pharmacies sometimes. Nobody means to do that. I, for example, have my staff, we talk daily, but sometimes you don't recognize all the hard work they do, or you don't seem to always give that pat on the back because you're just expecting them to do it. So that is something that we need to look at as pharmacy teams, especially in management. How do you recognize the efforts that people put in? And then the values clash with daily reality. You know, people's expectations, what they want to do, what they're getting paid to do. They sometimes find that what their expected role is and what their expectation is are two different things. And again, that brings into the unfair workload across the team. Some people find that they're doing more work than other people in that team. Then you go back into they feel that they're not recognized for what they do. So you start building this case in an individual where they're not getting enough time, they don't feel valued, they feel like they're working more than other team members. And then when they're trying to look for support or team support, they might not be calling out for it directly, but they might then feel isolated because they're feeling that when they do speak out, they're isolated for that. So this is this is not criticism to pharmacy generally, but it's just ways that we can look at our individual teams and find ways that we might be able to provide better support. So there is a little antidote there that I've said, naming the cause guides the fix. So if we know what's going wrong, we can then find a way to fix the situation, or at least look at solutions. And that's if you're a team member here that feels that any of these points are valid to you, or you're seeing these points in yourself, then do reach out to your team members. Do reach out to management, because sometimes you need to speak out without prejudice to yourselves so that action can be taken. Sometimes when you're quiet, nobody knows why you're quiet. Not everybody can figure this out. It might be common sense to yourselves, but to the person who's managing you, maybe it's not. Maybe they're not doing it on purpose. And sometimes people just misunderstand that. The communication is so key when it comes to these matters. So one thing we can all do for ourselves to stop burnout is to sleep well at night. Create healthy habits that maintain both our physical and mental health, because we need to have the right balance. A bit like how we know the yin and the yang. You have to have that balance. You have to move your body daily. You need to do physical exercise, eat regular balanced meals, reduce social media, set screen time, because we know that that's having an impact on people, what they see and what they're hearing. Even sometimes if it's not true, they start seeing things in a different way because social media has sometimes programmed us with its algorithms. but that's another topic for another day. Um, we need to schedule downtime. You can't work 6, 7 days a week. I know from my own experience of working non-stop, you know, I to me, I feel that's just the way I was built to kind of deal with working 7 days a week. But when I actually sit down and I look at my time and I think, well, hold on, you know what? Have I given myself enough time? Have I protected my own space so that I'm clear? Because in the end, if I'm doing 6 to 7 days a week of work, am I giving that quality of work that that job deserves of me? You can be everywhere and turn up everywhere and turn up to every shift, but just being there doesn't mean that you're actually there as a team member. Because sometimes when you've lost interest, you're just turning up to do the shift. You're not actually working there to do the work. And I hope some of you can understand where I'm coming from in this. It's not just about being available, it's about being there as a team member. And then we have mindfulness, and meditation daily. Like I said, these are just healthy habits that I've put down. It doesn't mean that everyone has to do all of these, but these are habits that we can learn from to try and change our non-working days or non-working hours and make them productive to give us a bit of peace of mind um, from our actual working time. So, how can we look at, mid-shift micro resets? Sometimes people laugh when I tell them about, box breathing and, in for 4 seconds, hold for 4 seconds, out for 4 seconds, hold for 4 seconds, over a 60-second period. Um, it sounds funny, but when you actually watch the video and the people use it, they find that they can sometimes get some benefit out of this. You know, um, Hand stretching and shoulder stretching and shoulder rolls, and there's so many things at the moment. Your smartwatch tells you to stand up nowadays. Take a break if it knows that you're stressed. If you've got a Samsung watch, you'll see that it starts telling you that you're stressed out. So, just looking at the shift on micro resets. Um, have a look at your thoughts. Don't just rely on what you hear. Just take some time to see what's going on. You know, Live that moment. And I think that's what it comes down to. You have to live the moment to feel like you're a part of something. Because sometimes we're so busy looking at what's happened in the past in our teams, what's going to happen tomorrow. We're so panicked about our lives for what might happen that we don't always live in that moment or we don't work in that moment. So just resetting our mindset really helps. And then we look at the build of a growth mindset. How can we change the relationships that we're having? Maintain those relationships with our friends and family and the wider community. If you're feeling like you're on burnout stage, that you're worrying about too many things, sometimes we need to connect to our friends and our family members and our loved ones just to feel that positive energy from them and feel connected. Look at small goals, focus on the small things. If you're finding it hard at work and things aren't going right, just look at things that you can do to build your confidence up so that, no one's expecting you to do 100 dossets in a week. If you can't do it, just look at trying to rotate between other staff members, take on 5 dossets, do them properly, and then the sixth one will be much easier. Reframe from negativity. You notice that sometimes we all have negative thoughts, we all have doubts, and sometimes we need to get hold of those negative thoughts and kind of steer away from them before they take hold of our mindset. take some time to protect or protect your personal time, should I say. Leave work on time. You know, if you can do overtime sometimes, that's fine, but try to stick to your routine of timing because once you get out of that routine, you start doing more and more work, but then you get into a burnout stage because then you don't feel rewarded. You might not be able to do those hours. Once you start promising your time, it's very hard to go back to your manager or your staff members and say, hold on, you know what, I did Tuesday for the last 4 weeks, but I can't do the fifth week. And that person will say, well, you've done it for 4 weeks, you're fine. Just do it for another week, do it for a couple more weeks, and then you feel like you have to do it. So set your boundaries. And again, pursue your hobbies. There's more to life than just work. Make sure you take that time to yourself. Positive self-talk is something that I believe is really good. Talk to yourself in terms of, don't discredit your own self. Don't say negative things about yourself. Try to reaffirm positive thoughts and maybe a positive voice from within to talk through the difficulties that you might be facing. So how do we manage burnout? Stress, if you are going through this, I would say to many people, set realistic expectations, speak to your manager or someone who's there for you. And again, I'm talking about our staff members or staff members here, but this could apply to a pharmacy owner. This can apply to a pharmacy manager. This applies to everyone. Just because you're the pharmacist owner doesn't mean that you're not going to have burnout. There's no sudden cures of being out of burnout if you are in burnout by being the pharmacy owner. So let's be realistic, put realistic expectations on yourself, focus on what you're doing. Sometimes you're not going to be, well, most of the time, none of us are perfect. So be real with yourself. And even if you're the main person in that team, set expectations that your team members understand of you. Because sometimes when people rely on you, their expectations are that that person will fix all their problems. And then they get too accustomed for you picking up all the odd ends. And that's not good. You need to turn around and have your teams trained that they can work without you. Or if you're a team member, then other people can do the job that you need them to do. Plan and manage your time. Don't just promise things to people. If a patient comes in, something's out of stock, it's not available, you know, don't just hold it there and then it becomes a confrontation last minute or it becomes a pressure for you to try and sort something out because the patient needed it on a Monday and you've left it till Friday. And on Friday, that patient's going to come and cause an issue with you. And then you're going to be in a very overwhelmed state. And it's hard to kind of sort the issue out. So if you have time beforehand, use that quality time to plan ahead. And if you can, manage the issue before it becomes a problem. Practice self-compassion, treat yourself with kindness that you show to your colleagues or patient. Don't be harsh on yourself. Don't blame yourself for the problems that are out there. We all get things right. We all get things wrong. We need to be reflective. If you got something wrong, put your hand up. If you got something right, put a pat on your own back. Sometimes you have to be your own fan. And that's not talking about only fans here. That's talking about you being the fan to yourself in terms of rewarding yourself with positive thoughts and being proud of the work that you do. Communicate early if you are going through problems, even if you're the boss and you feel like things aren't working for you properly, speak to your team. Don't get frustrated at people because you're frustrated in yourself. If you're a team member, speak to your supervisor, speak to your manager. A lot of the grievances that you sometimes see is because people have just not been clear, people have not set up boundaries, and because that communication is kind of broken down, the person who's going through the burnout and the stress, they might not be able to see that clear communication. So if you're a manager or you're an owner that's listening to this, be ready to listen to that person because at the time of burnout and stress, that person's not fully thinking in the way that you might be thinking. Their logic might not work in the same way that you would say is common sense. But for that person, the way that their thought process is at that moment might not be allowing them to think in the same way that you are. So it's important that when we're working in teams, and pharmacy is a team, profession. It's not one man band. You can't be Superman of the pharmacy because you're relying on all your staff members, and if you're the super technician or you're the super dispenser or the super counter person, you know what? You can't be everywhere all the time. So everyone goes through some sort of burnout, we all go through stresses. It can be even, financial issues that are being caused in community pharmacy that's straining how the owner acts or the manager acts. So if you start seeing people in your team or colleagues in your team, I would say if you start seeing mood changes, tempers, you start seeing them quieter, you know that something's not right in that person. Don't just leave them to it. Try and have a conversation. Maybe they'll talk to you, maybe they're not ready to talk to you, but just having that initial chat and leaving the door open for them to talk to you, it allows for the first step of understanding what they're going through. If you see people withdrawing, lunchtime is a good one. Many pharmacists teams have lunch times or have the team goes on a lunch in terms of individuals or maybe a couple of people at the same time. If you find that that person's isolated, maybe not eating, maybe it's avoiding the team WhatsApp group, that person's not in discussion. If they made a mistake, then they're not engaging about it. Don't just think that that person is okay or being a disruptive person. That person might just be withdrawing because they're not getting the attention they need. Slips at work, community pharmacy is hectic, but you might start finding that that individual is making the same mistake again and again. And sometimes we have even the most calmest person can lose their cool with individuals because they start seeing the same mistakes. Sometimes they say things that can be quite hurtful, even though it's said in a funny way. But when that person's going through burnout and stress, what you're saying to them is not coming into them in the same way that it'll be coming into you or the way that you're perceiving it. So perception is key, and especially if you're a manager or someone who's in management, the perception that you have of how the individual understands you, especially during burnout and stress, is not the same. You might find that the tone of that person towards yourself or even to your patients, it can be quite aggressive. The tone changes and that person might be out of order. Now, that can happen during conversations with people. We all lose our cool. But if it's consistent, if you're hearing that that colleague of yours is losing their cool unnecessarily, pull them aside and ask them if they're okay. Don't just tell them off. It's not, you know, unless you think that they're doing it on purpose or they've got some kind of issue, you know, don't call them out for it. Talk to them. It might be the stress. It might be that they are not coping in that situation. Maybe you need to jump in, talk to the patient, and allow that person to step back and then have a conversation with them so they know that you're there in a good way, that they will see their own mistakes. Because sometimes if you try and push someone to admit a mistake, or you push someone to think in the way that you're thinking, they're going to be difficult with you. But if you explain the situation and just try and, keep your tone down, give that person a few minutes, and then have a discussion, you can normally find what's happening to that person or why that situation occurred. So if you notice any changes, you are probably the right person to say something if you're seeing that your colleagues are showing or distress or stress in that sense. So conversations and communication is key. Um, Open privately. You know, you seemed a bit quieter this week. Just checking how you're doing. It's a simple conversation, but I like talking to my staff. I like talking full stop. So to me, it's quite common to ask my staff, what did they do on the weekend? How are you doing? What's happening with your kids? You know, just for me to get a sense check on what's going on in that person's life. So then I know how my tone and my um, approach to that person is. So if my staff are listening to that, they might now understand why I do that every week. Listen, don't fix. Um, if you see someone having issues, that sounds really heavy. Tell me more. You know, don't just give people advice, even if it's free. Sometimes people just want to listen. They want you to listen to them. They want to kind of, say what's from the heart. Even if they know that there might be a quick fix or you might have a fix for them, try to resist just finding the solution in that first conversations. If you find people are struggling, you know, how can you ask what helps? Talk it through with them. If you see that there are issues in terms of that person overworking and not responding to the way that you want them to, you know, ask them what's going to help right now. Let them feel appreciated, but let them feel like you're there for them. Um, that's really important. And then follow up with people. It's so easy to discuss something on a Monday and then put it under the carpet, for a couple of weeks. And then suddenly, even though you're seeing that that person's not acting the way that they should be, or they're showing signs of stress, um, you carry on doing nothing about it. You're not trying to figure out the problem, and that conversation hasn't led to anything. So that person, even if they're not being open with you, maybe it's difficult situation, but you as a manager or as a owner, you might be able to follow it up. Even if you're a member of staff that sees other people going through difficulties, just follow them up. There's no harm in having a conversation. And if the other person's not reciprocal, just try your best, but flag it up. So when we look at managers and team leads, what do we need to do in our pharmacies? We need to watch the workload, check have we got enough staff for the volume of work needed. When we have uncovered shifts, what are we doing? How are we supporting the people that need time out? One-to-ones matter, appraisals, ask people about the energy load, not just KPIs that's going to be affecting the business. Look at it as in how that person is supporting you. Don't just put pressures about KPIs, because KPIs, we all know that are important for our businesses. But if you've not got buy-in from your team and they don't feel like you're interested in them, they're not going to reach those KPIs for you because they don't see any value to it at that time. Back your team publicly. If you see patients coming in and being difficult and your staff member has been a bit abrupt, um, you can deal with that patient directly. But if you feel, if that staff member feels that you're undermining them at that time, it can cause a bit of distrust. So you have to, I know that all community pharmacy, managers and staff members, we're always on the fine line of trying to find a balance between upsetting our staff and upsetting the patient. Reset expectations. If there are targets that are non-essential, if there's things to be done that can wait for the next shift or wait for the next day, that aren't important. There's ways of looking at what's important in the day, what's not important in that day, making a list so you can understand the workflow and also track the progress. In leadership, I think conversation and communication is so key because once you lose that communication, you're no longer leading a team. They see you as an individual. They don't see you as someone they can turn to. So it's really important to have communication and trust between yourselves and the people that you work with. Looking at building a supportive team. So again, we're looking at, before the shift starts or in the morning when you walk in, what's happening, what's going on, what needs to be done, who's where, because sometimes we don't, and pharmacists, like myself, sometimes we're bad at this. We walk into our morning and we just expect things to be done. And sometimes they're not being done the way we want them to be done, but we've not set an agenda of what we need to do today. Recognize the good things if people are doing well. Um, do call it, do call those small wins. If they've got if they've done a lot of prescriptions that day, labeling or checking or whatever, you know, do recognize the good debrief tough days. When there are issues, when things have gone wrong, if something has happened as a mistake, again, don't just push it through the carpet. Talk about it because that incident is a way of learning. And I think anything where we've had difficulties, many of us try to hide behind that difficulty by just fixing the issue and not dealing with the actual cause, which is really important. We have to make it safe for people to speak, but it works two ways. So you as a manager or team lead need to make the environment right for people to speak in, but also make sure that you create boundaries that that honesty speaks for itself. Um, because otherwise, sometimes if you're, if too many conversations are happening and too much criticism is happening, then that can cause problems as well. So make sure that, there's no blame issues happening in these talks. It's a safe space to speak, safe space to have a discussion, but it has to be two-way discussions or three ways or four ways, depending on how many staff members you have and what you're talking about. Don't just have these isolated talks. Know your escalation. So again, it's really important to know your escalation. Everyone should know who to turn to when you're overloaded. Um, Even that person sometimes might be in a difficult position and they might feel overloaded themselves. But if you go up the ranks in your leadership route, sometimes the people are trained to deal with the issues. So don't just burden them with everything and anything, but just take some time to speak to them. Most of them, the manager, the team lead, they know how to deal with stuff because they've seen it. They understand it. They might have been in the position you're in, so they might have a better understanding. What do you do if you're going through burnout? So You can call your GP for guidance. If you need a sick note, you can get referrals. You might need to take time out. That's one of your contact points. We have the NHS mental health. We have talk therapies, and now we have tech support. You can talk to someone within 4 hours through the talking therapies. We now have the NHS 111, and we have a mental health option, which is new to 111, but it's really useful, where trained mental health professionals can talk to you about some of your concerns. You've got the Samaritans that are confidential advice 24 hours a day. And if there's a real danger and your mindset is, you're in a crisis situation, um, you're having very negative thoughts, even suicidal, when you feel things are just falling apart and you don't see any way out. If it's a serious emergency, you call 999, or you speak, so you turn up to A&E. And I would say that, if sometimes you feel like there's nothing else there, don't just shy away from it. Get the help. That help's not a negative situation. That help can change your life and the lives of people around you. So you don't need to face things alone. There is support available. Lastly, just remember, burnout doesn't happen overnight, and neither does the recovery. When you notice the signs, then you build healthy habits and you seek support early. The issue we all have is sometimes we want to fix the problem straight away. Remember, when you're going through these stresses, things take time, but there's a path. Create the path to change the future.